Welcome to the American Medical Extended Reality Member Question and Answer Series. In this series, we'll be highlighting the incredibly diverse and talented AMXRA community, one interview at a time. Join me, Dr. Mark Zhang, founder and president of AMXRA, as we learn more about medical extended reality through the perspective of AMXRA members. Welcome to another AMXRA member question and answer, and it's my pleasure. I'm your host, Dr. Mark Zhang, and I have today with me Dr. David Pearlstone, AMXRA member, and thank you so much for being with us, Dr. Pearlstone.
My pleasure. Thank you, Mark.
Yeah. So first, we always start with, who are you? Tell me about who you are and your pathway into kind of XR.
Sure, of course. I think I probably have kind of an interesting pathway into this. I spent most of my life as a surgical oncologist, here and there, doing a lot of academics, and I ended up in New Haven at Yale. And I saw a lot of the changes going on in healthcare. So I, on a bit of a whim, decided to go to business school. And that was a very, very wonderful experience and really opened my eyes to just a new way of looking at things. And that created a lot of interesting opportunities. Not to go off on that tangent about business school for physicians, but it opened a lot of doors. And it was through that I actually ended up in the startup world. Like all great things in life, really a lot somewhat by accident. Ended up meeting some people, and I had a job where I was vetting new technologies, particularly in digital healthcare. And one day in walked two gentlemen from a company and showed me some technology, and I was very, very, very much impressed. I was quite blown away. I had no idea, coming from the clinical world, that this was capable. And it really spoke to me because as a surgeon, it was just so hitting the nail on the head of things that I found frustrating: my inability to have good visualization, etc. That person turned out to be my now partner. We really hit it off. Interestingly, the company at the time, they were struggling because what they didn't have was any medical component to the company. So I brought that component to it. So at the end of the day, I ended up joining this company. I'm now CEO of a company called DICOM Director. We are heavily in the extended reality world. We make a product called IntraVision XR. And in a phrase, what IntraVision XR does is it allows you to visualize CT or MRI scans in extended reality, and perhaps more importantly than that, take those images to the full utility of extended reality, where you are now actually using that image on top of a patient, using it for real-time surgical guidance, etc. So, a long answer. Who am I? I'm a surgical oncologist who is now CEO of a software company. So how's that for a life change?
That's pretty incredible, and it sounds like, kind of reading between the lines, the technology that really kind of knocked your socks off was an XR technology. Is that correct?
Absolutely, that's exactly correct. I was, what I'm sure is quite typical for surgeons, that it's extremely frustrating. Now, granted, I was a couple of years ago, but I tell the story all the time that at 3:30 in the afternoon, and I'm knee deep into a really tough liver resection, and I decide I want to go look at the CT again for the fourth time during the case. So I now have to leave the table, have someone come unplug my headlight. I have to walk across the room with my hands like this because I'm scrubbed, and hopefully have somebody come help me use the computer to look at the CT. Possibly I'm still looking at a glass held up in front of a light bulb. But the point being, I've done it, I have to do this. And now I have to come back to the table and restart my complex operation. And we all know this is a terrible thing to do. And what was particularly irksome about this is this idea that this is going on literally at the same time my children are at home playing video games that have a level of technology that puts this to shame, to put it lightly. And so when to have sorry, just the camera. My partner Ted walk in one day and
Yeah.
show me this level of capability. And the funny thing is, I kept accusing him of it being fake because he said, this is from a CT scan, and Ted doesn't have the medical background, and so he was a little bit tenuous about what he was saying, and I was like, nah, this can't be from a CT scan. This is no, you had some artist made this, or something. No. Is it good? And I said, this is incredible. So I was extremely enamored of the technology. And now that I've spent a few years in this and I've got a little bit of familiarity, I wouldn't say much more than that, a little bit of familiarity with the underlying technology that's involved in this and how this has developed and why it has developed out of the world of helical CT and sort of the math behind it. It's really very fascinating and a very, very, very logical progression. Us moving into three-dimensional holographic imaging makes perfect sense now at this time. And again, I can make a whole big strong argument about why that is, but it really does make sense in terms of if you look at both the evolution of how CT scan has developed, going from the old school CT to helical CT, where we now have a three-dimensional object, et cetera. And then parallel, we have the development of augmented and virtual reality technology. Those two things merged together create a breakthrough in my really a different way.
Well, I think what's super exciting, what I'm hearing is that I've said this before in other kind of settings, but for me, XR was a slow kind of realization after like many months of looking that this is going to change how we practice medicine. It sounds like for you, it could be because clinically, I'm a palliative care doctor. I don't need my procedure famously is talking and family meetings.
That's a great point, and I love that point because on the one hand, you can have the situation of exactly why Ted and my other partner Ani were struggling at that time, because they were trying to sell this technology to the wrong kinds of doctors. They were trying to sell it to radiologists, and the first thing I said is, that's terrible. They're not going to be interested in this for a whole bunch of appropriate reasons. Just as I wouldn't try to sell it to a psychiatrist either. I said, this technology is geared towards what I call the end user of the CT scan. Right? That's the person who is going to use that CT to perform a procedure, very likely. And so that's ridiculous. But what's interesting and what's really fun about this whole world is how you and I, as a palliative care doctor and a surgical oncologist, and yet still can meet in the middle on this, because the capabilities for this extended reality extend beyond just how I can use it as a surgeon. I'm quite sure, and I don't know much about it, but the utility of this in palliative care in what I sort of lump together as patient experience and patient education and behavioral therapy. Right? Use of the technology are fantastic.
Absolutely. And it's one of those things where I think just back to that, when you first saw this technology, it was like that, because you just had a pain point that you just immediately saw that this solved. For me, what I'm seeing is like this, as I learn more, there are clear kind of obvious, or maybe not so obvious, but clear benefits, like the distraction therapy, options to help, non-pharmacologic options to manage pain or anxiety, or actually just to be in a different environment, the benefits of VR. But as you kind of talk about, from my field, I think there's going to be incredible opportunities to use it to just better engage with both the patients and their families in an environment that is a little bit more personal and a little bit more kind of direct than a Zoom or a Teams or a Google Meets meeting, right? Like, the concept of presence is such a pertinent thing when you're having like these relationships, and just the fact that when you're in VR, and you can look at the other person as they're talking, even in like a cartoon form, it's huge, right? Like it's such a change in having a conversation. So it feels like the other person is in a space with you, and there's just something
The
meaningful
immersion,
about that.
the immersive capability and quality is still to this day amazes me.
Yeah.
I put
Yeah.
on a virtual reality as an example, which has really the tremendous immersive quality to it. It still blows my mind. And what's fun about it is that, we're, oh my goodness, we're not even scratching the surface yet of
Yeah.
where this go. We're just thinking about the ideas. Wow.
So David, you have like a really fascinating background. So you were, you are a surgeon, an academic, and also went back and now are the CEO of a company in this space. And this is over the span, your intro. How long have you been kind of in the XR space now?
4 years.
4 years.
This is it'll be 5 years at the end of this year. End of December will be my 5th year. Hoping for a big celebration.
But congratulations. What have you seen in those 5 years? What has the change been, and what do you see for the future of this type of work and the field?
Wow, what have I seen? What haven't we seen? So much. When I started, we were on the HoloLens 1. There's a good technical milestone, if you will. And it's funny now, I think back and how appropriately very impressed I and everyone else was with the HoloLens 1. And now when I see what we can do compared to what we were saying, oh, gee whiz with back then, it's kind of funny. So not surprising. And, I guess I want to say, of course, the technology moving along has been exciting and fun, but, big deal. Of course, we expected that. What I'm I hope in the end will be fun, and I think will. But what's interesting now to be looking at is watching it all play out. It's like, and I don't know, the world's filled with metaphors, but the concept is solid. Now we got to figure out how we're going to use it and in what ways and what that's going to look like.
Yeah.
And that's just a big shuffle.
Yeah.
Things and there's going to be a lot of trying of things that aren't going to work.
Yeah.
Or work not as well, and it'll be painful for a lot of people. I say that as a startup.
Yeah.
But it'll be exciting, and it'll be very interesting. You can think back to the early days of the internet, or any of those things, and you realize now that what was kind of a crazy idea then, now is something we take for granted, and that's another thing I find very exciting. I am absolutely convinced, I hope I'm right, that this technology of extended reality, and I don't know what it looks like. That's another thing. I don't know what the hardware is going to look like. I suspect it's going to look something like this, much more than what it looks like now. I'm quite sure it will. But the fact that its penetration into so many components of our life, ways we haven't even thought about, I find that also very, very exciting. I like to say I look forward to looking back on this, and saying how interesting this was or that was, and remember when we thought we were going to do it that way, and that was. And I can give you 100 examples right now of things that 2 years ago I would have said, this is the way it's going to go. Absolutely. Say why? Oh, guaranteed. It's going to go. And now I'm like, what an idiot. Of course, we're not doing that. That makes no sense at all. We're going to go this way.
Well, speaking of which, I do have some questions. I think you're really well positioned to have I'd love to have your perspective on. The first is, it sounds like, you're DICOM director. Your primary platform is HoloLens. Is that kind of where you're currently at?
Well, thanks for bringing it up. I want to push back on that. I didn't want to push back. I want to be very sensitive to my
fair enough.
very best friends at Microsoft, because they are my very best friends. So maybe this is where you were going. There is so much going on in the industry right now in the tech, which again is fun and exciting. It's interesting. Uh, I hope this is what you were asking me, because I'll give you my answer anyway. What I think is going on. I think everyone just, anyone who's wringing their hands, I say, geez, my goodness, please do not worry. This is the inevitable, expected, necessary market shuffling. Is there going to be a HoloLens 3? Is there, Facebook Meta's now, and the Oculus has the Quest Pro, and they've dipped their toe into extended, and now Apple's going to, all of these things. And, I suppose if I was a stockholder at one of the companies, I'd be all kind of worried and strategizing. But from a higher level, this is all great. These are the giants figuring it out, how it's going to lie and what it's going to look like and who's going to run what. I've got my own theories about what I think Microsoft is thinking. Not like I have any kind of insight, but I've seen enough movies about how Silicon Valley works. And, I think there are sit downs, and I think get discussed.
And I think you're absolutely right. And actually, it's great to get that perspective. My sense is that, independent of the different companies and what they're doing, I think that, I totally agree. We're just this is a time of shuffling, and things will kind of hopefully level out as the technology matures and the use cases kind of follow. I was actually going to ask a more philosophical question. And again, this is a kind of I'm still very much a novice to this. I'm learning as I go, but it seems like there's almost like a Betamax to like VHS war. I guess I'm old enough that still trucks with me. Maybe it's like a DVD and wait, it was a Blu-ray and HD DVD, in the sense that for like these mixed reality kind of applications, there's like almost two kind of competing, or AR applications, two competing kind of pathways in many ways, right? Well, at least for the wearables. The first is more of the transparent holographic use case, which is like the Magic Leaps and the HoloLenses.
Optical see-through.
Yep, and then optical see-through. See, you're giving me. I'm learning more as I go. Talking about this. The second is kind of the other approach, which is more using camera arrays to, and
pass through.
Yeah, pass through. Tell me what, like, how do you think this is going to play out? Do you think they're going to be kind of independent, like parallel, and there'll be use cases for both, or do you think?
Great question. So first, let me give you my answer that makes me happy and allows me to sleep at night. As an ISV, as I've learned to call ourselves, as a software vendor, I don't care. You make it, I'll code for it. Sure. I don't care. Whatever works and whatever is great for everybody, that sounds terrific. It's fascinating. I absolutely know what you're talking about. Optical see-through versus video pass-through was a differentiation I'd not even heard of 6 months ago, and now is suddenly on the tip of everybody's tongue. A lot of that has to do with the Quest Pro coming out, and forgive me if I'm speaking out of school here in any way, but which went very specifically, made a choice to go that route, which is not surprising given the history of Quest, because the Quest 2 had cameras. So it's surprising that the Pro went that way. My understanding is the Apple device is also going to be that way. I don't have any opinion. I don't know. I can think of, and I'm not the tech guy, but I can think of, I think, reasons maybe what the advantage of the video, that it gives you more opportunity to work with that data that's coming in. Right now in the HoloLens, you have a huge amount of the work is the computer generated image, and a bit of work is done in assessing the environment and understanding the environment. I think with, I'm again just guessing here, but I'm going to guess that with the video devices, there's much more you can do with the real world part of the mix of the real world video, computer world. I don't know. It'll be very interesting to find out if I'm right. I have no idea. But it's funny. I was very struck by the fact that they're going this route. Because it does take the user one little step further away from the real world, is the term we're going to start using a lot in the real world. And that almost makes me a little uncomfortable. I say all the time that I like AR because in medicine, there's not too many times we want to be in a black box.
Yeah. Yeah.
So now they're going to give us a black box that has cameras. Okay, maybe.
You know, and I think the other piece, I love. First of all, I think your perspective is super valuable, especially given, you know, you're a surgeon, you know, and you know, how comfortable would you ever be with a camera guiding you in that way? That seems.
And yet, how do we do all the surgery these days?
Endoscopy, right? Yeah.
Looking at a camera, right?
Yep,
or how about sitting at a hutch 10 feet away from the table?
That's
I'm not
fair.
even touching the patient, or I'm not looking at the patient or touching the patient.
That's fair.
So,
that's fair.
You know, what a crazy world we live in, right?
All right. Okay, I got one other question.
Wait, let me give you one cool. Let me give you a cool one on this, since you brought it up in surgery. So one of the cool things, and I'm sure we're not the only ones working on this. That you can do with the video pass through is it gives you these opportunities like magnification. So now, instead of having to wear heavy glass loops, in other words, digital magnification versus true optical glass magnification.
Yeah.
Interesting.
Really interesting. You know, the other use case I heard about in passing, I actually don't even remember who was bringing this up, but it never occurred to me, and it makes a ton of sense, is the opportunity to actually do endoscopic procedures in 3D, which you know, having depth seems like a good idea. Not a surgeon, but I remember holding the camera for those procedures as a med student, and having the intern miss like their cuts because of lack of depth, right? Like, so there's a way where that makes a ton of sense.
Don't get me started on this. My partners hate it when I talk about the fact that the magic of the 3D representation that we all experience in even the most complex of these devices is a concept that's been around since the 19th century. It's well, the reason it makes us think we're seeing 3D is the same way as a stereopticon works. If you just separate the left eye from the right eye and show each eye a separate picture that's offset by the distance between two eyeballs, your brain will interpret that as depth of field. So absolutely, we can cheat and create depth.
It makes sense to me. You know, why not? That seems like a pretty incredible opportunity in the field of kind of procedural medicine with XR. All right, one other question. Very, I think, appropriate for your background plus what your company does. You know, what's your take, and how are you playing around with any of these kind of 3D monitors or hologram kind of?
You know, that's a great question. You're the first one to ever ask me that question. My quick answer is no, but maybe I should be. I've seen these kinds of devices where you create the perception of 3D in a different way than what I just described. All I can say is what I've seen to date has not impressed me. That the other way of doing it seems much better. You know, and there are some other devices out there that create 3D that involve a pair of glasses, but also another type of device. I don't know how they work. And I have made the argument that there's a lot to be said for a single self-contained device, you know, whether it's a pair of glasses or whatever it may be. So, and I know that there is work already bringing this to the contact lens level. So if we can achieve this through something like glasses and contact lenses, why would we want to go with a monitor?
No, that's fair.
But who knows?
Well, this has been a really exciting conversation. I have one last question. You know, so you know, you're a member of the American Medical Extended Reality Association, AMXRA. We're still pretty early. What most excites you about kind of what we're doing, and what do you see in the future? Like, what are you hoping for with this society? And yeah.
That's great, and then this is really in the front of my mind right now. That what my hope is what's great about something new is that we don't have all the bad things, all the bad habits, all the bad structures, all the bad things that happen in organizations that are old and well established. That over the years of it being in existence, bad mistakes were made, and we live with them. Well, so now we have the opportunity to really create. To take a term, a professional organization, whatever we want to call it, or just a school, a discipline of study, whatever you want to call it. So my goal, what I would love to see, oh my goodness, for once in medicine, it's not even for once, we've done it before, let's do it again. Let's break down the silos.
Yeah.
Let's get the departments within institutions talking to each other and working together, and let's get the different institutions. I think sometimes we actually do better with different institutions cooperating than we actually do within institutions. You and I see this all the time in extended reality. I'll meet somebody at a very prominent healthcare facility, and they're all in on XR. They're doing this and this and this. Is everybody else here doing that? No, nobody. There's literally a person down the hall doing the exact same thing. It happens all the time. So that's my biggest goal, my wish. That we can gain all the benefit of pooling data, not siloing it, so that all the doors are open and all the barriers are broken down, so that we can move the benefit of the technology forward without getting all mucked up in ourselves like we always seem to do. So that's my wish.
I think that's a very, I hope that's a very achievable goal. And
well, AMXRA, this is it. You've got the reins.
We're trying to do it.
I'm not saying it just because it's you and I'm on here, but this is what we need. And now is the time before things get too set in their ways. And I am on that mission to get everybody to join this group just because this group exists and you started it. Okay, great. Let's start here. So.
Yeah, we got to start somewhere. Worst case scenario, we're in a position to make new mistakes happen. Best case scenario.
I hope so. Hey, we always, I don't believe it 100%, but there's a lot to be taken away from that very big dictum in the startup world is fail early and often.
Yeah, I'll take 70. 70 is still better than a fail. So.
Well, I always say, fail early and often is all well and good in the startup world, but it's not so great in healthcare.
Not in healthcare. That's absolutely. But if you're doing a society, maybe you have a little wiggle room.
Yeah.
Well, Dr. Pearlstone, it's really been a pleasure. Where can people connect other than AMXRA? Of course, if you're a member of AMXRA, I feel like I feel like I have to do obligatory plug. You can reach out using the AMXRA board and the chat function as a member. But let's say others who are still thinking about joining, how can they get a hold of you?
Oh, absolutely. We'll go to our website, www.dicomdirector.com. There's an info link there. It goes right to my email. So great. David.pearlstone@dicomdirector.com. I'm easy to find. I'm on LinkedIn. As I always said when I was a doctor, if you have trouble finding me, it's on your end, not me, because I'm very findable. But yeah, go to our website, please. Take a look at the technology, and you know what? The rising tide floats all boats. Anything that will get anybody into this technology and appreciating it and understanding it and seeing the value, I'm all in on that.
Perfect. Well, it's been a real pleasure, and I hope we have you on in a future episode, and we'll talk about kind of the next generation, and maybe we'll have some more insights on kind of the balance of pass through versus see through, right? Like so.
It'll be
a real pleasure. Take care.
My pleasure. Thank you.
Yeah.
This has been a production of the American Medical Extended Reality Association. Our mission is to advance the science and practice of medical extended reality through advancing care delivery, scientific investigation, innovation, education, advocacy, and community. If you are interested in learning more or joining AMXRA, please go to www.amxra.org to learn more. Bye now.